Hi everybody. So I am 2 weeks post-op now, and I actually, for the first time, went somewhere. My husband and I, we took our kids to the zoo today, so we can get out the house, and I feel fine. I'd say about maybe about 20 minutes, 30 minutes into going to the zoo, I did start hurting, mostly like kind of like the bottom incision, and then and the nipples have been, oh my God, they've been so sensitive. They just, like, if they touch anything, they hurt. But I'm glad they work. I'm glad I still have feeling, because, you know, some people lose nipple sensation completely. Some people lose their nipples completely. So I'm thankful for that. I'm thankful for healing. My breasts are starting to take on a normal shape. They're not swollen as much. They're still a little bit swollen, but they might be swollen, for 3 to 6 months. It just really depends. But for the most part, I feel pretty good. When I look at my incisions, I'd show you, but I don't think my husband would like that. So not going to share you guys what the incision around my nipples looks like. But maybe in a later video, I'll show you what it looks like, the bottom incision when it heals. Right now, the bottom incision still, you can still kind of see that like it's pulled from the stitches. So I have dissolvable stitches under there, and they clearly haven't dissolved yet. But the incision around my nipple, like every day, it's starting to look more and more normal, like, you know, back to normal of how my nipples looked before I had kids. Not before the surgery, before I had kids. After my 1 week appointment, when he removed the tape, riding in the car, like to get back to my house, it was just brutal because the office that I go to is about 30 minutes away from my house, and my husband's car is a Toyota 4Runner, and I just felt every bump in the road. And so that day and the day after, I was just extremely sore, and I took a nap like last Saturday, I think it was. I took a nap for like, I don't know, 3 hours or something like that. Like, I was just really hurting. But then after that, my legs started hurting. So I was worried that it could possibly be a blood clot, because I do have a family history of blood clots, one of my siblings. So, for a few days, I would just try to walk around as much as I could. And I walked around the yard. We have a pretty big yard, so I walked around the yard. I did a few laps around the yard, equivalent to a mile. And my legs were still hurting a few days ago. So, but it felt like, I don't know what a blood clot feels like, but it felt like, you know, if you haven't worked out in a while and you decide to work out and go hard, and then you're super sore the next day, that's what it felt like. And then when I would stand up, my legs would feel a little bit heavy, and my ankles, it would feel like blood going to my ankles or something like that, or fluid, or whatever the case may be. So I ended up calling the advice nurse, and the advice nurse spoke to a doctor at the time, and he said that I probably don't need to go in because I'm still low risk. But then the nurse scheduled me with an appointment, a video appointment, the next day. So then I met with the doctor on a telehealth appointment, and he told me that the only way he'd be able to tell anything was if I come in, which I figured that would be the case. So he tried to get me an appointment to that same day to go in to have a ultrasound done on my legs and blood work. However, since it was so last minute, they couldn't fit me in. So he just encouraged me to go to urgent care, which I did. So I called my sister. She came and she hung out with my kids. And my husband took me to urgent care. The urgent care is about less than 30 minutes away from here. So we went there. I went and I checked in, and the nurse at the check-in said that, you know, they had a lot of people in there, and so it would be a while. So I think we got there at like maybe 6 o'clock, maybe 6:30 we arrived there. And then probably around 8:20 is when a doctor came out and got me. And when the doctor came out and got me, she said, well, we don't have a room for you, but let's go in here and we'll chat. So I talked to her about the family history. I talked to her about how I was feeling, letting her know that I was about, like, at that point, a week and a half post-op. And I was letting her know that, normally I'm used to, up and moving around and working out and all that stuff. And I haven't done that for all this time. So I was thinking it was maybe because I just wasn't as active as normal. And then I told her, about the family history, all that stuff. And she said that it's important to note the family history, but from what I was saying and what she was seeing, I sounded low risk. So then she had a nurse come and take my blood, and they did a bunch of blood work, and then they had me go back out to the waiting room, and then I waited for about maybe 20 more minutes, and then they took me, they finally had a room open, so they took me to a room, and a nurse came in, told me to just take off my pants and put on a robe or a gown. So when the other nurse came to take me to the ultrasound tech, that I'd be ready. So I waited in that room for probably a good 30 minutes. I was hoping that, they would come and just get me and take me, but no, it was a good 30 minutes. So then they wheeled me to the ultrasound room, and it turned out that the lady was on her lunch break. So I was waiting while she was on her lunch break. But, I found out that, she was 6 months pregnant. So I was like, all right, pregnant lady has to eat. So I'm okay. And then, so I had to lay down on a table, and she put like a warm jelly on my leg. She did one leg at a time. It was basically from the hip down to the ankle. And, she kind of slowly went and pressed as she went to take pictures of the veins. She told me that the veins in my shin and my calf, are kind of tiny, so it was a little hard to see. But she also told me that if it was a blood clot, you would be able to notice it. It would be like a big spot on the vein. So she did that to both legs. That took about 30 minutes. And then she wheeled me back to the room. And then I'm realizing that I probably waited a lot longer between all these times, because I didn't leave there until about 11:15. But she took me back to the room, and then I waited for the doctor to come in. So she said what she had to do was write the report, and then the doctor would read the report, and the doctor would let me know the results. So the doctor came in the room, let me know the results. She said, okay, you're probably dehydrated, and it is probably because you're not getting as much exercise as you're used to. Just make sure you're walking, and if you're laying in bed, make sure you're moving your legs around, doing leg exercises. When I was during my procedure, my nurse told me that if I have to lie in bed, to move my feet like this. So I've also been doing that as well. But I think the main thing, it might have been the dehydration, because when I was first out of surgery, the first few days post-op, I was making sure that I was drinking a lot of water. And then I think, the subsequent days after, when I started doing more for myself and more with the kids, I think I kind of forgot to make sure that I was drinking enough water. So I think that's what it was. And so yesterday, I had my lime water in the morning, and I had tea, and I made sure I was drinking water throughout the day. And all right, so my son Gavin is out there having a fit because he wants to come in, but he's not coming in because all he's going to do is jump on the bed and mess up my video. Okay, he might not mess up my video. He is super cute though. But anyway, so I've been making sure I'm more hydrated today. Like I said, we went to the zoo today, which going to the zoo was okay. I had a good workout. I did get in a lot of steps. According to my Samsung Galaxy watch, I have had 5,314 steps today. So I'm happy about that. I am a little exhausted though. I'm a little sore in the under incision, but for the most part, everything is going good. The incisions look great. I was looking at myself in the mirror yesterday, and I was just so happy with how I look. I'm glad that I picked the doctor that I did because he's had extensive experience. He's had so much experience with, breast surgery, breast reconstruction surgery, reduction, different things like that. And so I knew that he would be the best person to make sure that everything looked symmetrical. And so I was just looking at like the scar that kind of goes down. And it looks so good. Like, I feel like it's going to fade without a problem. It's almost like you barely even see it. And that's what impressed me too when I saw his before and after pictures, because I saw one of two Black women and they both kind of looked like the scar was virtually not there. And I was like, oh my God, they must have good scar cream. That's what I was thinking. I was like, oh, they must have good scar cream. But I think, really picking the correct doctor who will, when they put you back together, because you really are just like open and then they put you back together. Like I always say, I feel like a patchwork quilt, but you want to make sure you have a doctor that will do that seamlessly and just make it look really nice, because that's what my doctor did. And so I'm not having any issue. I've been using this Neosporin around my incisions, and I apply it. My doctor told me to make sure I apply moisturizer 3 times a day. I've only been doing it twice a day. When I started doing 3 times a day, and I was using Vaseline, and I was using lotion, and I was doing a mixture, and then my scars started to itch a little bit. And so I was like, you know what? I have this Neosporin. I forgot that I had this. And I was like, let me go ahead and use that. And it's been helping a lot. And it says that it's supposed to last for 24 hours, I believe. So that's why I decided to only use it twice a day. But it definitely really helps. And I think that I've turned a corner when it comes to healing. I think I'm just healing great. I don't have any openings. I know a lot of people have issues with their incisions opening up. I don't have that issue at all. I'm still wearing a compression bra. So as you can see, I look a little flat, but I'm not completely flat. I'm just compressed. And so I'm required to wear this compression bra for another week. However, I think I'll continue wearing the compression bra until, all the swelling goes down, and until my breasts, go back to their natural shape, which they say is about 3 to 6 months. Hopefully it's more so 3. I think so. I feel like they're already kind of trying to settle. I feel like maybe I'm a quick healer, because it seems like, I'm healing pretty quickly, and I'm just really excited with the results. I'm so happy that I did it. When I was looking in the mirror yesterday, and I was just like, boy, these look great. I have 20-year-old looking boobs, y'all. My boobs look like they did when I was 20. I am telling you. So even if you do, maybe you don't have big breasts, but you want to do a lift, I'm telling you, it is just like life changing. Like, I just know when everything heals, I'm just gonna be walking around like this. Woo! No, but I'm serious. but yeah, no, I'm excited. I'm glad I did it. I'm wearing a button-up shirt, and my boobs are bursting through the buttons. So that's one of the great joys of this. It's so exciting. I'm happy. I'm happy with the decision that I made to do this, and I'm excited, and I will continue to talk about my journey. I will do a before and afters. I wanted to wait until the stitches dissolved before I start doing before and afters, because like I said, it's a little painful in the under boob incision. So my next video will be at 3 weeks, and at that point I might be able to do a before and after. But so far so good. I'm doing well. My nipples are alive still. And so at this point, you know, I think I'm in the clear. I think they're good. And everything is all good. I am thriving, but I'm still taking it easy. You know, my husband asked if he can go back to work next week. I'm like, nope, I need the full 3 weeks because, you know, you'll at 3 weeks, everything, the stitches should be dissolved and I should be okay to start doing things. But the healing process is still like a 6 to 8 week process. So it's not like, you know, 3 weeks and boom, I'm done. No, it's still going to be a little tough for me. And I do have, you know, 2 little kids, and my youngest son has special needs. So it's definitely, you know, not going to be easy when my husband starts going back to work. So we shall see. He works in news, so he might have to actually go into the newsroom for his first week back. I don't know. I'm hoping that he can just work from home the first week back. We'll see. But I know that he is really dying to get out the house and get back to work and, you know, keep fulfilling his purpose. But yeah, everything is all good and I'm doing great. Make sure you check back in with me for the next video, which will be posted in a week, and it'll be my update for how I'm doing 3 weeks post-op. All right, thanks for watching. Make sure you like this video and subscribe to my channel. Bye.